Are you wondering how to heal leaky gut and the gut damage that occurs with it? Leaky gut syndrome is a very common condition. It causes all sorts of digestive problems and it causes problems throughout the rest of the body. In this video, I'm going to cover what really causes leaky gut and the best natural ways to heal it. I'm Dr. Mark Stengler. I'm a naturopathic medical doctor, and I've been in practice for over 30 years. I've treated thousands of patients with leaky gut syndrome. In this video, I'm going to give you the tips and the techniques that I use to really help patients heal very quickly. Now, remember with leaky gut syndrome, you have damage to the small intestine lining. The small intestine is the gatekeeper, so it basically regulates what gets absorbed into the bloodstream and what gets excreted out through the digestive system. But because of problems in the American diet, processed foods, bad fats and bad oils in the diet, high sugar diets, artificial sweeteners which damage the microbiome, a low fiber diet which does not feed the good microbiome. These are all things which contribute to a leaky gut. In addition, the use of pain medications, especially the non-steroidal anti-inflammatory drugs such as the acetaminophen, the ibuprofen, and other pain-relieving drugs. While they have their place, constant use of them has been shown in studies to damage the lining of the intestinal tract. Chemicals in the environment also are associated with causing leaky gut. Another common cause is not handling stress well. Excessive levels of stress basically lead to the elevation of stress hormones in the body, and that reduces blood flow to the digestive tract, to the small intestine, and so you can't get the nutrients that your small intestine needs. These are some of the common causes we see with leaky gut syndrome. So what I want to do now is go through the most important natural healing agents, the things I can find help patients feel better in just 1 to 2 weeks who have leaky gut. Let's start with the first one, and that's glutamine. Glutamine is an amino acid, and it's a preferred amino acid for the small intestine. It helps with healthy intestinal cell turnover. So like most places in the body, your small intestine cells do regenerate, they do renew, but you have to supply it with the right nutrition. And glutamine certainly is an essential amino acid to help with this. Next, aloe vera extract. Aloe vera is a very nice anti-inflammatory plant extract. It also promotes healing of the gut, so I like to use it in a powder form. It works very well. In addition, a form of licorice known as DGL, which stands for deglycerinated licorice, a type that does not have the potential to elevate blood pressure, is excellent in terms of helping to heal the lining of the small intestine. And we know in studies it promotes circulation to the small intestine and the stomach, and it helps with that natural mucus layer being formed, which is protective to the lining of the small intestine. Also, I like the calming herbs for the digestive system, slippery elm and marshmallow root. Both are historically used for their soothing and anti-inflammatory effects on the gut. Moreover, I like to use quercetin. High absorbable quercetin has been shown to reduce the histamine effects that occur within the gut. So when you're reacting to a lot of foods, your immune system is dysregulated, you release histamine, which also causes problems to the small intestine lining. So often with patients, I'll use a combination of these ingredients. I'll have them take them before breakfast and dinner on a consistent basis. And again, most people will feel a difference within 1 to 2 weeks. About 80 to 90% of patients will notice within 1 month a substantial improvement in their leaky gut symptoms, such as gas, bloating, abdominal cramp, abdominal pain, better bowel movements, the stools are more formed. But also what patients notice, because leaky gut affects the whole body, when you have poor absorption, you're absorbing toxins into the bloodstream that you shouldn't be, that affects your joints, your muscles, your cognitive function, your hormone balance, your energy levels, your mood. And so all these general things start to improve as well, usually within 2 to 4 weeks. So there you have it. These are the techniques I use with patients. Very simple, very safe, very effective. For more videos on leaky gut syndrome, see these videos.